Have at her. Thank you. Let me know as soon as it's up.
Excuse me, Chair McLeod, we're live.
Thank you so much. And it is 5:20 on Monday, October the 4th, 2021. And I call to order this meeting of the Town of Collingwood's Corporate and Community Services Standing Committee. We have 4 members of the committee today. We have regrets from Councillor Comey. And I will turn to Councillor Berman for our land acknowledgement.
Thank you, Madam Chair. For more than 15,000 years, the First Nations walked upon and cared for the lands we now call home. Anishinaabek, Haudenosaunee, Ojibwe, and many others who cared for their families and communities the way we now seek to care for ours. The Town of Collingwood acknowledges the Lake Simcoe-Nottawasaga Treaty of 1818 and respects all of the nation-to-nation agreements that have formed relationships with the original inhabitants of Turtle Island, the reality of our shared history, the current contributions of Indigenous people within our community, and seeks to continue empowering expressions of pride amongst all of the diverse stakeholders in this area. We seek to do better to continue to recognize them and grow in friendship and in community, nation to nation.
Thank you. Item 2 on our agenda this evening is the adoption of our agenda, and the motion is that the content of the Corporate and Community Services Standing Committee agenda for October 2021, October 4th, 2021, be adopted as amended. There is an amendment, which is a staff report, which is 5.1 CCS 2021-03, mandatory vaccination disclosure policy and administrative delegation of authority. May I have a mover and a seconder to adopt the agenda? Vice Chair Madigan and Councillor Berman, and all those in favor. I'm not going to ask if there's addendums because we already did. Item number 3, which is business arising from the previous meeting. Are there any items of business arising from the previous meeting? Seeing none. Item 4, declarations of pecuniary interest. Are there any declarations of pecuniary interest from members of the committee tonight? Seeing none, I will move on to staff reports. And I will be turning to Executive Director Peg. And also, I believe Clerk Almus is included in item 5.1 on our agenda, which is staff report CCS 2021-03 regarding COVID vaccinations. Executive Director Peg.
Thank you, Chair McLeod. I'll just wait one moment while Clerks pulls up the presentation.
Sure.
All right, wonderful. So good evening, members of council. I appreciate the opportunity to provide you with an overview of the proposed COVID-19 mandatory vaccination disclosure policy. Following this overview, I will ask that Clerk Almus provide a summary of the portions of the staff report that speak to delegated authority. Next slide, please. The town is committed to providing excellent and safe services to our community and to building trust and confidence in local government. The town is fortunate to have highly qualified and dedicated staff that have delivered the services our town needs consistently throughout COVID-19, responding to rapid changes in a nimble and professional manner. Council also has not missed a single meeting and has transitioned to and improved options where people can participate electronically. Next slide, please. As an employer, the town of Collingwood has an obligation under the Occupational Health and Safety Act to take every reasonable precaution in the circumstances for the protection of a worker. COVID-19 is a respiratory disease that has caused significant morbidity and mortality both globally and locally in Simcoe, Muskoka. As of August 2021, there have been over 500,000 cases in Ontario and almost 10,000 deaths. Widespread measures like stay-at-home orders, closure of public spaces, physical distancing, and universal masking have been necessary to prevent infections, prevent deaths, and protect the healthcare system's capacity to treat individuals who become ill. As such, the town has a strict suite of COVID-19 protocols that protect staff and the public. And I'll name a few. So vehicle cleaning procedures, work from home procedure that applies to about 10% of our workforce, in-person gathering procedures, daily staff screening, contractor pre-screening protocols, cash handling procedures, case management procedures, among others. Next slide, please. On September 1st, Dr. Gardner, the Simcoe-Muskoka District Medical Officer of Health, recommended that workplaces have vaccination policies. Our proposed policy on mandatory declaration of vaccination status would add to our comprehensive and continuously improving suite of current protocols and procedures. This policy gives us the ability to emphasize the benefits of vaccination to our staff and determine if there are situations to be addressed to better protect public, council, and our valued employees. Next slide, please. The purpose of the policy. So, to help reduce the risk of COVID-19 transmission, the mandatory vaccination disclosure policy is in line with the public health guidance and supports the direction that getting both doses of the vaccine provides a high level of protection against COVID-19 and related variants. Vaccination is an important intervention that prevents the spread of COVID-19 and has contributed to decreasing cases and deaths in Canada. Knowing the vaccination status and the medical exemptions of our staff and council members within the workplace will enable us to plan appropriately for everyone's safety and to determine if additional requirements are merited in the future. Next slide, please. Many organizations within multiple different sectors have implemented vaccine policies, including several County of Simcoe municipalities. A range of requirements are being set by policy. For example, some municipalities are requiring mandatory vaccination. The proposed policy today is mandatory disclosure of status, not mandatory vaccination. Staff reviewed a wide variety of approved policies, and I'll give a high level just of a few. So those who have implemented mandatory vaccination of some or all employee groups include the County of Simcoe, the City of Barrie, City of Toronto, and Clearview Township. And those who have implemented mandatory disclosure policies, so similar to the one we're recommending today, City of Kitchener, City of London, North Cumberland County, Oxford County, and the Town of Hanover. And that is not an all-inclusive list. There's many municipalities under each of those categories, as well as some municipalities that have not yet taken the step to implement a policy. It is important to note that a key consideration during the development of our recommended approach is the safety risk in the workplace and enhancing our ability to assess the site-specific workplace risks of workers and their potential exposure to contracting or transmitting COVID-19. Thank you. So the policy overview highlights the application and scope of the policy, different roles and responsibilities for workplace participants, as well as provides for the procedure for providing proof of status, any exemptions, accommodation for those exemptions, vaccination education, rapid antigen testing, and confidentiality. Next slide, please. The policy would apply to all employees of the town of Collingwood, regardless to their employment status, and as well as members of council. The policy would also apply to new employees and student placements as a condition of employment, unless, of course, an accommodation for an approved exemption is required. Contractors, consultants, and volunteers are not currently contemplated in the scope of the proposed policy. However, staff are exploring options to ensure the utmost protection of staff in the community. As noted previously, the town does have a robust suite of other COVID-19 protocols that help mitigate risk relating to these groups at this time, such as the pre-screening with contractors. Next slide, please. In terms of accommodation and continued diligence, the town recognizes that not all workplace participants may be eligible to receive a COVID-19 vaccination. For those who are unable to be vaccinated due to an approved exemption, As part of the town's duty to accommodate, it would be best practice and is recommended that we would supply those individuals with rapid antigen tests. The procedure for doing so is captured within the proposed policy. The rapid antigen testing is another screening tool that aids in mitigating the risk of the spread of COVID-19. Public health guidelines and workplace participants, including those who have been vaccinated, would continue to be required to follow all provincial, federal, and local COVID-19 requirements. In addition, town staff would still need to adhere to town set safety policies, procedures that remain in effect, except as outlined in this policy. Next slide, please. In terms of financial implications, currently staff do not anticipate any significant financial implication in the adoption of the recommended policy. However, as noted in the report, it is proposed that those with medical exemptions would be provided with rapid antigen testing kits at the expense of the town. At this time, staff are not aware of the magnitude or impact of potential exemptions, as at this point, we are not aware of who within our organization is vaccinated or not. In the event that through this process, we determined there was a significant financial impact, we will report back to council. Next slide, please. And I believe actually that concludes my portion of the presentation, and I'll now ask Clerk Elmas to provide a summary of the Delegated Authority. Thank you.
Thank you, Executive Director Peg. As for the administration delegation of authority components, as staff were determining the appropriate approach regarding vaccination policies, it was identified that no formal authority was provided to the CAO or the designate to approve, amend, or dissolve administrative policies without the express authority of council. And we've been looking at this rules framework for over a year. This delegation of internal corporate policy approval to the CAO would cover vaccination policy changes for staff after it's endorsed. However, council would retain the approval authority for council members themselves, in particular, any policy that adjusts a member's ability to participate in in-person meetings. Next slide. The delegation exemptions. In terms of approvals, all bylaws require the approval of council to be in effect and enforceable in a court of law. Other governments' documents that require council approval include any policy, protocol, or standard that would directly impact the corporation as a whole or that were created to move a corporate objective forward. Examples of a corporate policy include notice policy that sets out notice requirements to the public on matters being considered by council, customer service policies, how staff and council communicate to each other, the media and the public to ensure consistency and transparency. And additionally, any decision delegated to staff will remain within the requirement that council is granted funding through their annual budget adoption. Next slide. So this rules framework, governance documents within the rules framework that impact members of council, committees, or boards, or the public will continue to require council approval. There may be some rules that will continue to require council approval as required by legislation or in general are a best practice. And as identified in this document, the rules framework provides that governance document approval is generally by bylaw or council resolution, and again requires council approval. And corporate policies, procedures, or standards that are external will require council approval, but administrative policies, procedures, and standards internally would be at the CAO or designate. So the recommendation, staff are recommending an amendment to the delegation of authority bylaw to provide such authority for administrative policies, procedures, or standards that impact departments within the corporation with minimal impact to council, residents, or the community and are necessary for the efficient, safe, and effective operation of administration. So as identified in the staff report, the CAO or designate would have the opportunity to approve, amend, or dissolve any corporate administrative policy, procedure, or standard that impacts departments, impacts the organization internally, and department heads would have the ability to approve and prepare or dissolve any sort of departmental rule or procedure that is in place. An example of that would be a procedure on the processing of an open air burning application permit, or any other internal process that delegates how staff administer, how they conduct and administer pieces of their regular work administration that, again, don't require or impact the community or financially that's outside of their approved adopted budget. So that is the recommendations that we're looking for today, together with Executive Director Pegg's recommendation.
Thank you so much. I will turn to the attending public, all, I think, one of them, to see whether there are any questions or comments regarding this report.
Certainly, to our attendees of the meeting, if you wish to address the staff report, please press the raise your hand feature, or press *9 if you're on the telephone. And it doesn't look like anybody wishes to participate in this conversation at this time.
Thank you. And so I will turn to members of the committee, and we will get this on the floor for discussion. So I'm looking for a mover for item number 5.1, CCS 2021-03, mandatory vaccination disclosure policy, that staff receive it. The mandatory vaccine, okay, I just have to give in. Mandatory vaccination disclosure policy and administrative delegation of authority be received, and that the mandatory vaccination disclosure policy G-06 be adopted, and bylaw 2021-069, being a bylaw to amend the delegation of authority for administrative policies, be enacted and passed. I have a mover in Vice Chair Madigan and a seconder in Mayor Saunderson, and I will open the floor to questions, comments, and queries. Are there any? Vice Chair Madigan.
I'm happy at committee level, just to go by Bob. It's supposed to be a little bit more laid back. Great report, as everybody always says, but I do have one question. Will this affect our summer students that might be under the age of 18, that we might have to then speak with their parents? I've got no problem with this whatsoever, but I know with our federal government handing out money, like it's easy not to work. I just don't want to be affected in a very tourism-based town where we depend on our summer students in Parks, Rec, and Culture. And if I'm told to don't worry about it, I won't worry about it. Thank you.
Who would like to take that, Executive Director Pegg or Clerk Almus?
Thank you, Chair McLeod. Through you to Councillor Madigan. The intent of the policy as drafted is that it would apply to students that are eligible to receive the vaccination. In the instance where a student was unable due to an exemption, then we would work with them on a case-by-case. Point heard though around recruitment, it's my understanding currently that we're not challenged to find summer students for our positions, other than maybe a few such as lifeguards. But certainly if that became an issue, we would raise that with department heads and the CAO and explore it at that time.
Anything further? There we are. Yes, something further.
Yeah, no, I read the report extensively, and it's not on a base to base if you can't get it or not. My comment was if they're 17 and underage to make a decision for themselves, would we be asked, not we as counselors, but you as department heads, be asked to then have to deal with their parents, or would this effectively eliminate anybody under the age of 18? Because to be honest, under the age of 18, they can't enter into a contract with anybody, as far as I know. That was my comment. My question, I understand that if you can't get it through a medical exemption, that's not my question. My question is, if they're under 18, are we then going to have to deal with their parents? Because I'm sure there'll be another initiative next summer that will keep people at home not working, unfortunately.
Executive Director Pegg, can you comment on the 18 years old thing?
Thank you. I would have to confirm around the employment contract piece, but the COVID-19 vaccination, those under 18 and eligible are able to get the vaccine without parental consent.
Thank you. Any other questions from members of the committee? Councillor Berman.
Thank you, Madam Chair. Through you to Executive Director Peg. You covered my questions. I just wanted maybe a little more clarification. You said, and I know this isn't exact, but you said roughly 10% of town staff work from home. I think I heard you say, and I was just wondering if anybody knows a little more specifics. Like, I think we have somewhere in the area of 250 or 260 municipal staff. So you're saying 25, 26 roughly are working from home?
Thank you. Through your Chair McLeod to Councillor Berman. That is correct. So our last sort of group of the number of staff working remotely was give or take around 35 employees. So we divided that out by the number of staff we have. That said, we do have a number of staff that are working a hybrid model. So some days at home, some days in the office, just maintaining those COVID procedures that we currently have in place. But yes, give or take around 30, 35 employees.
Okay, great, thank you. And my next question, which you had touched on, was the unknown cost of the rapid antigen testing. And maybe anybody can answer this. I thought I had heard it's about $40 a pop. Does that sound even close? Does anybody have any idea? No? Okay.
Edie Peg has an idea.
Thank you, Chair McLeod. So currently there is a program for free rapid antigen testing, but we're not certain on how long that program may last. You're correct. We've heard it's, I would say, somewhere around the ballpark of $50 to $60. But if you're traveling and you go to, the local pharmacy, it can be upwards to $200. So I guess it depends on where you're getting your test done, but we would certainly look at making sure we procured those in the proper way and in the most cost-effective manner.
Okay, thank you. And what, if any, downside is there to, under the scope, to not including committees and such? Like, it covers council and so on and so forth, but it doesn't cover the committees. And I know you explained that. I just wondered what the logic was.
Edie Peg.
Thank you, Chairman, to Councillor Berman. So we did discuss the application of the policy and thought that moving forward with employees and members of council at this time was a really big positive step in the right direction. We absolutely had conversations around the application and are working on considering what that application might look like, recognizing that committee members that are volunteers that are interacting with members of the public or could be an in-person meeting, so would be value to having a policy in place there as well. We just wanted to work through a little bit more of the logistics before we rolled out the policy on that scale, but it's certainly top of mind for department heads and the CAO, and we're having active conversations on how that policy could potentially apply. Just wanted to iron out some of the details first.
Okay, thank you. And one last question through you, Madam Chair, to Executive Director Peg. I think from your explanation or your list of municipalities that are making a disclosure policy versus making mandatory vaccinations, that there is nothing to prohibit us from making a mandatory vaccine policy. It's a choice that council, well, that you've recommended that council's going to make, but there isn't anything prohibiting us from making it mandatory.
Yeah. Thank you, Chair McLeod. So you're correct. There are municipalities that have implemented those policies, and there are cases that are trying the different policies that are implemented and being challenged in different avenues. There is nothing today that suggests that we could not implement a mandatory vaccination policy. We just thought this initial first step of gauging the magnitude of what we're working with, maybe 99.9% of our staff are already vaccinated, and that's great. But before we move to that measure, we just wanted to understand sort of the landscape we're operating within. But you're correct. If council directed staff in that way, there's nothing prohibiting us from doing that.
Okay, thank you. So then just last comment, because I'm not going to ask for anything different. I love the report. Should you decide to move to mandatory vaccines, you've got my vote. I'd like to do it as soon as possible. Thank you.
Thank you, Councillor Berman. Any other questions, comments from members of this committee? Mayor Saunderson.
Yes, thanks, Madam Chair. Through you to Amanda. You mentioned that just following up on the issue that Councillor Berman raised, that this is really our starting position, and that based on what we learn from the mandatory reporting, then we may have cause or not have cause to come back and revisit whether or not we would go to the next step of a mandatory vaccination policy. Is that the idea?
Through your Chair McLeod, that is correct. So at this point, we're looking at what is, again, the current state of the landscape, and then we would work together on determining, based on public health guidance and best practice, if it was warranted to a mandatory vaccination policy. It's certainly something we contemplated, but again, wanted to ensure we understood the current state and the pros and cons of each approach. And certainly if through that expedition, we determined further action was required, we will work with the CAO department heads and potentially council on implementing any further steps.
Okay, thank you. And just to follow up, if I could. So if we determine that it may be an issue, would we have a requirement for an education session in order to have employees understand the pros and cons of vaccinations?
Executive Director Peg.
Thank you, Chair McLeod. Yes, so the policy provides a procedure that if an employee either does not disclose or is unwilling to disclose their vaccination status, or discloses their status as unvaccinated, then they would be required to attend a mandatory education session that would provide an overview of the benefits of vaccination, the risks of not being vaccinated, et cetera. And we would use content from the health unit and World Health Organization and whatnot to create that. And then following that education session, they would be required to complete rapid antigen testing if they continued to want to remain unvaccinated or fail to disclose their current status.
Great, thank you. Those are my questions.
Thank you. And the questions that I had have been answered. And so I will call the question. I do have a mover and a seconder on this, don't I? I do. And so we vote. All those in favor, please. Thank you. That is carried. And we move on to item number 6. Thank you so much, Executive Director Peg, for that thorough report. And we move on to item number 6, which is reports and minutes of other committees and boards. And the motion is that the minutes of the various committees and boards provided below be received and that the recommendations contained therein be approved, including item 6.1, the Accessibility Advisory Committee minutes from September the 21st. The item 6.2, the special Collingwood Downtown BIA Board of Management minutes of September the 1st, 2021, and the Collingwood Downtown BIA Board of Management minutes of September the 9th, 2021. The Museum Advisory Committee minutes from September the 23rd of 2021, and the Trails and Active Transportation Advisory Committee minutes from September the 9th of 2021. I have a mover and a seconder to accept those reports, Vice Chair Madigan and Councillor Berman. Anybody need to discuss anything on any of these reports? Thank you. I have a question about one of them, but I don't believe that we have anyone who can answer it at this meeting. So I will save that for when the report from this committee ends up at council. And so I'll call the question. All those in favor of receiving these reports? Thank you. That carries. Consent agenda, item number 7, and the motion is that council hear and receive the general consent agenda, and further that the information and opinions provided in the general consent agenda items are those of the authors and are not verified or approved as being correct. And we have on the consent agenda item 7.1, Northumberland County's early resolution reforms in Bill 177, and Northumberland County's capital gains tax on primary residences. Any questions or comments on either of these two items on the consent agenda, members of this committee? Oh, I think I need a mover and a seconder, don't I? Thank you. Moved by Councillor Berman, seconded by Vice Chair Madigan, and I will call the question. All those in favor? There we go. That carries. Item 8 is departmental updates. And I know that we have one, actually, I know that we have two, but we will begin with Sunset Point Shoreline Protection update. And for that, item 8.1, we turn to Director Culver. Hello.
Hello, thank you, Chair. We just thought it would be important to note that we're changing direction a little bit temporarily, I should say, with respect to how we're approaching shoreline protection at Sunset Point soon. Initially, we had, as Council will recall from the budget, we'd been planned on doing some revetment work this summer. And actually sort of toward the latter part of the summer, some COVID challenges got ahead of us, as well as the window for in-water work as required by the MNRF got ahead of us. So we're now in a place where we have some concerns about the threat of October and November storms. Council will be familiar with what's happened in the past, and we've seen while the waters receded, in some ways that actually makes it more challenging. So in any case, predicting for the worst case scenarios, we're going to be applying a sandbag treatment to a portion of the West Beach at Sunset Point. It won't be the most attractive thing, and I know that will create some concerns. However, it is a temporary measure. When the window opens up again in the spring, we hope to get started on the block wall on the west side of the West Beach, as well as the other remediation revetments that we have been planning and working with our shoreline engineer on throughout the summer. So just wanted to make sure that Council and the public had a heads up about what they might see occurring in the next few weeks. And again, hopefully it's understood that this is all part of saving and preserving Sunset Point.
Thank you. Any questions or comments from members of the committee for Director Culver on this issue? Excellent. Thank you so much. I am going to go next to Treasurer Quinlan. Yes, Fire Chief Ross, I see you. And I will be coming to you shortly. Clerk Olmos, yes.
Certainly, through Chair McLeod. Previously, I indicated an update regarding the tax rate error that was in the previous bylaw, and Treasurer Quinlan is going to report under departmental updates under the SIC meeting that's been recessed. So we'll do it under there. So all of Council understands that as the tax rate really is within the mandate of the SIC.
Thank you very much. I appreciate that update. And so that provides room for Fire Chief Parr. Come on down. Hello.
Good afternoon, Chair. Thank you for allowing me to jump in here at the end. Just to inform everybody that this is Fire Prevention Week in Ontario. The theme this week is Learn the Sounds of Fire Safety. So I encourage everybody at home to push their smoke alarm, know the sound, and practice their fire safety drills and any other things that they could think of at the time, excuse me, when doing these kind of things. We had a great success at the farmers market on the weekend. Lots of people stopped over to the booth. We put out on social media people pushing the button and learning the sounds of fire safety. So I encourage everybody to continue this week. Thank you.
Thank you. Any questions or comments for the Fire Chief? Try not to be too noisy. No. All right. Thank you very much. I think I need to return to Director Culver. He has an update on another issue, not related to waters and shorelines.
Thank you, Chair. I did want to, with some regret and for reasons beyond her control and ours, make mention that Claudia Ferraro, our current Poet Laureate, is electing to end her term for personal reasons. Claudia served as a Collingwood second Poet Laureate starting from October of last year, and during her term made a remarkable number of appearances at the community and civic gatherings, created poetry installations for our parks and trails, offered workshops and hosted events during a time made challenging by the necessity to gather virtually. So Claudia's accomplishments include hosting a virtual panel discussion with writers from across Ontario, partnering with other regional poet laureates to create co-hosted open mics for local writers, creating a winter trail of poetry at Harborview Park, creating the poetry art installation at the Arboretum inspired by the theme of resilience, and created from found objects such as books and poems. She penned many new works and performed at such events as the Mayor's Levy, International Women's Day, and the Regional Arts Action Network. So on behalf of the community of Collingwood, we want to thank Claudia for her contribution to the arts and literary community, and wish her all the best in her future endeavors. And I'll just close by mentioning that plans for the Poet Laureate program will be, for the next iteration of the Poet Laureate program, will be announced in early 22.
Thank you very much. Questions? Mayor Saunderson.
Thank you, Madam Chair. I'm very sorry to hear that, Dean. Wondering if this committee could recommend that the mayor, I write a letter thanking Claudia for her great work in the short time that we had her, and wish her all the best.
I don't even think we need a motion for that. We'll just nod and smile and say yes. Or do we need a motion, Clerk Almas? No, we do not. Yes, what a great idea. Thank you. Thank you, Dean, Director Calder. And that brings us to item 9 on our agenda, which is public delegations. And this is when we open the meeting to members of the public who are in attendance who would like to have things to say to us, and they get 5 minutes to do so. And do we have anyone, Clerk Almas, who is interested in saying things to us?
Thank you, Chair McLeod. So we do still have an attendee for this meeting. If you wish to address the committee within anything that's within the mandate of the Corporate Community Services Standing Committee, please press the raise your hand feature. And not at this time, Chair McLeod.
Thank you. So we move on to item 10 on our agenda, which is other business. And so I turn to members of the committee and ask if they have anything else, other business that hasn't been addressed that needs to be. Seeing none, I move to item number 11, which is the adjournment. And I'll need a motion to adjourn. There it is from Vice Chair Madigan. And we will call the question. All those in favor of adjourning at 5:57 p.m. There we go. This meeting stands adjourned. Thank you for your attention.
Well done.